Imagine walking into a doctor's office, and instead of a stethoscope, they pull out a red-hot iron rod. Instead of antibiotics, they hand you a glass of liquid mercury, and instead of surgery, they suggest drilling a hole directly into your skull while you're wide awake. This wasn't some medieval torture chamber. This was cutting-edge medicine in ancient Greece, where the cure was often deadlier than the disease itself. Welcome back to another journey through history's more questionable moments. Tonight, we're exploring the fascinating and frankly terrifying world of ancient Greek medicine. While the ancient Greeks gave us philosophy, democracy, and the Olympics, their approach to healing the human body was, well, let's just say you probably prefer to stay sick. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here, and let me know in the comments where you're tuning in from and what time it is for you. It's always fascinating to see who's joining us from around the world. Now dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. Get comfortable, close your eyes, and let the steady rhythm of ancient knowledge guide you into peaceful rest. So, settle in, get comfortable, and let's dive into a world where bloodletting was considered sophisticated, and where the most dangerous person in any Greek city wasn't the warrior or the politician. It was Our story begins with a fundamental misunderstanding that would kill countless people for over 2,000 years. The ancient Greeks believed that all illness stemmed from an imbalance of four bodily fluids, or humours. There was blood, representing heat and moist phleg, representing cold and moisture, yellow bile, representing heat and dryness, and black bile, representing cold and dryness. According to Greek medical theory, when these humours fell out of balance, illness occurred. Too much blood made you feverish and impulsive. Too much phleg made you sluggish and cold. Too much yellow bile made you angry and bitter. And too much black bile made you melancholic and depressed. Now this might sound almost reasonable in a primitive sort of way. The problem wasn't necessarily the theory, it was the treatment. To restore balance, Greek physicians had an arsenal of remedies that were often more dangerous than the original illness. And the most popular treatment of all, bloodletting. The logic was simple. If you have too much blood, just remove some of it. How much? Well, that's where things got interesting. Greek physicians would drain anywhere from a few ounces to several pints of blood, depending on the severity of the imbalance. They used a variety of methods. Sometimes they would make small incisions with a sharp knife. Sometimes they would use heated cups to draw blood to the surface. And sometimes they would simply attach leeches to the patient and let nature take its course. The problem with bloodletting, of course, is that it weakened patients who were already sick. A person suffering from pneumonia, for instance, would have their blood drained, leaving them even less capable of fighting off the infection. Many patients who might have recovered from their original illness died from the blood loss instead. But bloodletting was just the beginning. Greek physicians also practiced purging, the deliberate induction of vomiting and diarrhea, to expel excess humours. They would give patients powerful emetics and purgatives, substances that would cause violent expulsion of stomach and bowel content. One popular purgative was hellebore, a plant so toxic that it could cause seizures, paralysis, and death. Another was scammony, a plant that caused such severe intestinal cramping that patients would writhe in agony for hours. The Greeks believed that the more violent the purging, the more effective the treatment, so they would often give patients multiple doses of these toxic substances, continuing until the patient was completely emptied out. Now you might be wondering, didn't the Greeks have any good doctors? What about Hippocrates, the famous father of medicine? Surely he knew what he was doing, right? Well, here's the thing about Hippocrates. While he did establish some important principles, like the idea that diseases had natural causes rather than supernatural ones, many of his specific treatments were just as dangerous as anyone else's. Hippocrates lived in the 5th century BCE on the Greek island of. He founded a medical school there and wrote numerous treatises on medicine that would influence Western healing for centuries to come. His most famous contribution was the Hippocratic Oath, which included the phrase, "First, do no harm." The irony is that Hippocrates and his followers did quite a lot of harm. Take his treatment for epilepsy, for instance. Hippocrates believed that epilepsy was caused by an excess of phlegm in the brain. His solution? Drill a hole in the patient's skull to let the phlegm drain out. This procedure, called trepanation, was performed with primitive tools and no anesthesia. The patient would be held down while a physician used a sharp instrument to bore through the skull bone. Many patients died from the procedure itself, either from blood loss, shock, or infection. Those who survived often suffered severe brain damage or died from subsequent infections. Yet Hippocrates and his followers continued to recommend trepanation for a variety of conditions, including headaches, mental illness, and head injury. Hippocrates also promoted the use of cauterization, burning tissue with hot irons, to treat everything from wounds to hemorrhoids. The theory was that heat would purify the affected area and restore balance to the human. In practice, cauterization often caused severe burns, infections, and scarring. Patients would be held down while red-hot irons were applied to their skin, causing excruciating pain and often making their condition worse. But perhaps Hippocrates' most dangerous legacy was his emphasis on crisis treatment. He believed that illness progressed through predictable stages, culminating in a crisis where the patient would either recover or die. This led to a hands-off approach, where physicians would simply wait for the crisis to occur, doing little to actually treat the patient. Many people who could have been saved with proper care were left to die because their doctors were waiting for the natural progression of the disease. Hippocrates also established the practice of prognosis, predicting the outcome of an illness based on observation. While this sounds reasonable, it often became a self-fulfilling prophecy. If a physician predicted that a patient would die, they might withhold treatment, ensuring that the patient did indeed die. Surgery in ancient Greece was performed without anesthesia, without antiseptics, and often without any real understanding of anatomy. The Greeks had a surprisingly sophisticated understanding of some aspects of surgery. They could set broken bones, suture wounds, and even perform some complex procedures like cataract removal. But their lack of knowledge about infection, anatomy, and pain management made even simple procedures potentially fatal. Let's start with pain management, or rather, the complete lack of it. Greek surgeons had no effective anesthetics. The closest thing they had was opium, which was occasionally used, but it was rare and expensive. Most surgical patients simply had to endure the agony. Common surgical procedures included the removal of bladder stones, an excruciatingly painful operation that was performed by cutting into the patient's abdomen or perineum while they were fully conscious. The patient would be held down by several strong men while the surgeon probed around inside their body with crude instruments. The mortality rate for this procedure was enormous. Many patients died from shock during the operation. Others died from infection afterward. Even those who survived often suffered permanent damage to their bladder, bowels, or reproductive organs. Another common Greek surgical procedure was the treatment of cataracts. Greek surgeons would use a sharp needle to push the clouded lens back into the eye, theoretically restoring vision. This procedure, called couching, was performed without any anesthesia. The patient would be held down while the surgeon inserted a needle into their eye and manipulated the lens. The pain was indescribable, and the procedure often resulted in blindness, infection, or even death from shock. But perhaps the most horrifying aspect of Greek surgery was their complete ignorance of infection. They had no understanding of germs or bacteria, so they made no effort to sterilize their instruments or maintain clean conditions. Surgical instruments were often rusty and dirty. Operating areas were filthy. Surgeons would move from patient to patient without washing their hands or changing their clothes. As a result, most surgical wounds became infected. The Greeks actually thought that pus was a good sign. They called it laudable pus and believed it indicated that the body was healing. In reality, the presence of pus meant that the wound was infected and the patient was in serious danger. Many patients who survived the initial surgery died days or weeks later from gangrene, sepsis, or other complications. The Greek approach to treating these infections was typically to apply more hot irons or to drain more blood, which only made things worse. Greek surgeons also performed amputations, though their technique was crude and often fatal. They would simply cut through the limb with a sharp knife or saw, then cauterize the wound with hot irons. There was no understanding of how to properly tie off blood vessels or prevent infection. The survival rate for amputations was extremely low. Most patients died from blood loss, shock, or infection. Those who survived often suffered from chronic pain, phantom limb syndrome, or other complications that the Greeks had no way to treat. If Greek surgical practices were nightmarish, their pharmaceutical treatments were often outright poisonous. The ancient Greeks had access to a wide variety of plants, minerals, and animal products that they used as medicines. Unfortunately, many of these substances were highly toxic. Let's start with one of their favorite remedies, mercury. The Greeks believed that mercury had magical healing properties and used it to treat everything from skin conditions to syphilis. They would give patients liquid mercury to drink or rub mercury ointments on their skin. Mercury, of course, is a deadly poison. It causes severe damage to the nervous system, kidneys, and brain. Patients who were treated with mercury often developed tremors, memory loss, and personality change. Many died from mercury poisoning, though their doctors attributed these deaths to the original illness rather than the treatment. Another popular Greek remedy was antimony, a metallic element that was used to treat various ailments. Like mercury, antimony is highly toxic and can cause severe poisoning. Greek physicians would give patients antimony compounds to induce vomiting, believing that this would purge the body of disease. The result was often violent food poisoning that could last for days. Patients would suffer from severe nausea, vomiting, and diarrhea. Many became severely dehydrated and died from the treatment rather than the original illness. The Greeks also used arsenic as a medicine, particularly for treating skin conditions and fever. They would give patients arsenic compounds to drink or apply arsenic ointments to their skin. Arsenic poisoning causes severe gastrointestinal distress, organ failure, and death. But perhaps the most dangerous aspect of Greek pharmacology was their use of plant-based poison. Many of the plants they used as medicines were highly toxic, and the Greeks had no way to accurately measure doses or predict effects. Hemlock, for instance, was used to treat various ailments despite being deadly poisonous. This is the same plant that was used to execute Socrates. Greek physicians would give patients small doses of hemlock, believing it would cure their illness. Too much, and the patient would die from respiratory paralysis. Aconite, another plant poison, was used to treat pain and fever. Aconite, also known as wolfsbane, is extremely toxic and can cause heart failure and death even in small doses. Greek physicians had no way to standardize the dosage, so patients were essentially playing Russian roulette every time they took this medicine. The Greeks also used colchicum, a plant that contains compounds similar to those found in chemotherapy drugs. While colchicum can be effective for treating gout, it's also highly toxic and can cause severe poison. Greek physicians would give patients colchicum for various ailments, often causing more harm than good. Perhaps most disturbing was the Greek practice of using human and animal excrement as medicine. They believed that feces had healing properties and would apply animal dung to wounds or give patients human waste to consume. This practice, needless to say, was a perfect way to introduce dangerous bacteria and parasites into the body. Many patients died from infections that were directly caused by these fecal remedies. The Greeks also used urine as medicine, believing it had purifying properties. They would have patients drink their own urine or the urine of others, or apply urine to wounds and skin conditions. While urine is generally sterile when it leaves the body, it can become contaminated with bacteria and other pathogens. The practice of drinking urine provided no medical benefit and often made patients sicker. If Greek medicine was dangerous for men, it was absolutely lethal for women. The Greeks had particularly bizarre and harmful beliefs about women's health. leading to treatments that were often more dangerous than the conditions they were meant to cure. Greek physicians believed that women were fundamentally different from men, not just physically, but mentally and morally. They thought women were naturally weak, irrational, and prone to hysteria. This led to medical treatments that were both ineffective and often fatal. The Greeks believed that many women's health problems were caused by the uterus moving around inside the body. They called this condition hysteria, from the Greek word for uterus. According to this theory, the uterus could become dislodged and wander around the body, causing various symptoms. To treat hysteria, Greek physicians would try to lure the uterus back to its proper position. They would place sweet-smelling substances near the patient's genitals and foul-smelling substances near their nose, believing this would attract the uterus downward. Other treatments for hysteria included violent massage of the abdomen, the insertion of various objects into the vagina, and the application of hot irons to the skin. These treatments were not only painful and humiliating, but often caused serious injury or infection. Greek physicians also believed that women needed to be regularly purged to maintain their health. They would give pregnant women powerful emetics and purgatives, believing this would prevent complications during childbirth. The result was often miscarriage, premature labor, or death from dehydration and exhaustion. Many women who could have had healthy pregnancies died from the treatments their doctors prescribed. Childbirth itself was extremely dangerous in ancient Greece, partly due to the medical interventions that were considered standard practice. Greek physicians would often interfere with natural labor, using instruments to speed up delivery or extract the baby. These interventions, performed without anesthesia or antiseptic precautions, often resulted in severe tearing, infection, or death. The maternal mortality rate in ancient Greece was extremely high, and medical intervention was often the cause rather than the cure. Greek physicians also performed primitive caesarean sections, though these were usually only attempted when the mother was already dead or dying. The procedure was performed with crude instruments and no understanding of anatomy or infection control. The survival rate for caesarean sections was essentially zero. Even if the baby survived the delivery, it usually died shortly afterward from infection or other complications. For women who survived childbirth, the postpartum period was filled with dangerous medical intervention. Greek physicians would prescribe bloodletting, purging, and various toxic remedies to help women recover from delivery. These treatments often caused severe anemia, dehydration, and infection. Many women who survived childbirth died during the recovery period from the treatments their doctors prescribed. The Greeks also had particularly harmful beliefs about menstruation. They believed that menstrual blood was toxic and that women needed to be purged regularly to prevent the buildup of poisonous substances in their bodies. This led to treatments that were designed to increase menstrual flow, including the use of toxic plants and violent physical manipulation. Many women suffered severe bleeding, infection, and other complications from these treatments. The Greeks had various theories about the causes of mental illness, but their treatments were universally brutal and often fatal. The most common explanation for mental illness was demonic possession or divine punishment. Greek physicians believed that mad people were either being punished by the gods for some transgression or were possessed by evil spirits. The treatment for possession typically involved violent exorcism rituals that could last for days. Patients would be beaten, starved, and subjected to various tortures designed to drive out the evil spirits. Many died from the treatment itself. Even when Greek physicians attributed mental illness to natural causes, their treatments were no less dangerous. They believed that madness was caused by an imbalance of the humors, particularly an excess of black bile in the brain. The treatment for this imbalance was the same as for other conditions: bloodletting, purging, and the administration of toxic substance. Mentally ill patients would be subjected to repeated bloodletting until they were weak and anemic. They would also be given powerful emetics and purgatives that would cause violent vomiting and diarrhea. The theory was that this would purge the excess black bile from their system and restore their sanity. In practice, these treatments often made mental illness worse. Patients who were already confused and distressed would become even more disoriented, after being weakened by blood loss and dehydration. Greek physicians also used physical restraints and confinement to treat mental illness. Patients would be chained up in small, dark rooms and left alone for days or weeks at a time. They were often denied food and water, supposedly to weaken the evil spirits that possessed them. The conditions in these early asylums were horrifying. Patients were kept in filthy conditions, often naked and covered in their own waste. They were beaten regularly by their caretakers and received no medical care beyond occasional bloodletting. Many patients died from neglect, malnutrition, or infection. Those who survived often emerged in worse condition than when they entered, their mental illness compounded by trauma and physical deterioration. The Greeks also practiced trepanation, drilling holes in the skull, as a treatment for mental illness. They believed that mental illness was caused by pressure in the brain, and that drilling holes would release this pressure. The procedure was performed with crude instruments and no anesthesia. The patient would be held down while a physician used a sharp tool to bore through the skull bone. Many patients died from the procedure itself, either from blood loss, shock, or infection. Those who survived trepanation often suffered severe brain damage that made their mental illness worse. There was no understanding of brain anatomy or function, so the holes were often drilled in random locations. Greek physicians also used various forms of shock therapy to treat mental illness. They would subject patients to extreme cold, heat, or pain, believing that this would shock them back to sanity. One common treatment was to throw patients into too ice-cold water or expose them to extreme heat. Another was to apply hot irons to various parts of the body. These treatments were not only painful, but often caused serious injury or death. The high infant mortality rate in ancient Greece was due not just to disease and poor nutrition, but also to the harmful medical treatments that were routinely administered to sick children. Greek physicians believed that children were essentially miniature adults and treated them accordingly. They would give children the same toxic remedies that they gave adults, often in doses that were far too strong for small bodies. Bloodletting was commonly performed on children, sometimes on infants only a few days old. Greek physicians would drain blood from babies who were already weak and struggling to survive, often causing death from shock or blood loss. They would also give children powerful emetics and purgatives, causing severe dehydration and electrolyte imbalance. Many children died from these treatments, their small bodies unable to cope with the violent purging. Greek physicians had particularly harmful beliefs about teething. They believed that the process of cutting teeth was inherently dangerous and required aggressive medical intervention. Common treatments for teething included bloodletting, purging, and the application of various toxic substances to the gums. They would also perform scarification, deliberately cutting the gums to help the teeth emerge. These treatments often caused severe infection, and many children died from what should have been a normal developmental process. The Greeks also believed that fever in children was always dangerous and required immediate treatment. Their approach to treating childhood fever was typically to drain blood, induce vomiting, and administer various toxic remedies. Children who might have recovered naturally from minor infections were often killed by these aggressive treatments. Greek physicians also performed surgery on children, including trepanation for conditions like epilepsy or head injuries. These procedures were performed without anesthesia on children who were already sick and vulnerable. The survival rate for childhood surgery was extremely low. Even children who survived the initial procedure often died from infection or other complications. Perhaps most disturbing was the Greek practice of infanticide as a form of medical treatment. They believed that some children were born with incurable conditions, and that it was better to kill them than to let them suffer. This practice was particularly common for children born with physical deformities or developmental delay. Greek physicians would often recommend that these children be abandoned or killed, rather than attempting to treat their condition. The Greeks had numerous healing temples dedicated to Asclepius, the god of medicine, where people would go to seek divine cures. These temples, called Asclepians, were found throughout the Greek world. The most famous was at Epidaurus, which attracted pilgrims from across the Mediterranean. People would travel for hundreds of miles to seek healing at these sacred sites. The treatment process at an Asclepion was elaborate and often dangerous. Patients would first undergo a purification ritual that involved fasting, bathing, and various other preparations. They would then make sacrifices to the god and sleep in the temple overnight. During this sleep, patients were supposed to receive healing dreams from Asclepius. Temple priests would interpret these dreams and prescribe treatments based on the divine messages they contained. The problem was that these treatments were often just as dangerous as secular medicine. Temple priests would prescribe bloodletting, purging, and toxic remedies, claiming that these were divinely inspired cures. They would also perform various rituals that could be harmful to patients. One common practice was to have patients walk barefoot over hot coals or sharp stones, believing that this would purify them and aid in their healing. Another dangerous practice was the use of sacred snakes. The Greeks believed that snakes had healing properties, and patients would be encouraged to let snakes crawl over their bodies or even bite them. While most of these temple snakes were non-venomous, some were not, and patients occasionally died from snake bite. Even non-venomous snake bites could cause serious infections, particularly given the unsanitary conditions in many temples. The temples also practiced a form of incubation therapy, where patients would sleep in underground chambers surrounded by snakes. The idea was that the snakes would absorb the patient's illness and transfer it to the earth. These underground chambers were often poorly ventilated and filled with various noxious gases. Patients would sometimes suffocate or die from exposure to toxic fumes. Temple medicine also involved the use of various drugs and potions that were supposed to induce healing visions. These substances were often psychoactive and could cause serious psychological and physical harm. Patients would be given these drugs and then left alone in dark chambers for hours or days. Many experienced terrifying hallucinations, and some never recovered from the psychological trauma. The temples also practiced various forms of faith healing that could be dangerous. Patients would be encouraged to believe that their faith alone could cure them, leading some to abandon necessary medical care. This was particularly dangerous for patients with serious conditions like diabetes or heart disease, who needed consistent medical management to survive. Throughout Greek history, there were numerous famous physicians who gained reputations as skilled healers, only to leave trails of dead patients in their wake. These celebrity doctors often did more harm than good, but their fame protected them from criticism. One of the most famous was Erasistratus, who lived in the 3rd century BCE. He was considered one of the greatest physicians of his time, and was said to have performed miraculous cures. In reality, his treatments were often fatal. Erasistratus was a strong advocate of bloodletting, and would often drain enormous quantities of blood from his patients. He believed that most diseases were caused by plethora, an excess of blood in the body. His treatment for fever, for instance, involved draining blood until the patient was on the verge of fainting. Many of his patients died from blood loss rather than from their original illness. Erasistratus also promoted the use of violent purgatives, and would often give patients multiple doses of toxic substances to induce vomiting and diarrhea. He believed that the more violent the purging, the more effective the treatment. Another famous physician was Herophilus, who lived in the same period as Erasistratus. He is often credited with founding the study of anatomy, but his methods were brutal and often fatal. Herophilus performed vivisections on living humans, usually criminals or prisoners of war. He would cut open living people to study their internal organs, causing excruciating pain and death. He justified this practice by claiming that it was necessary for medical advancement, but the knowledge gained was often inaccurate, and the procedures were essentially torture sessions. Herophilus also performed numerous surgical procedures that were far beyond the capabilities of ancient medicine. He would attempt complex operations on the brain, heart, and other vital organs, almost always with fatal results. His surgical techniques were crude and his understanding of anatomy was limited, but his reputation as a skilled physician led many patients to seek his services. Most of them died as a result. Another notorious physician was Praxagoras, who lived in the 4th. He was known for his innovative treatments, which were often more dangerous than the diseases they were meant to cure. Praxagoras believed that many diseases were caused by corruption in the blood, and developed increasingly extreme methods of purification. He would give patients combinations of toxic substances that would cause severe poisoning. He also developed a technique called critical bleeding, where he would drain blood from patients at specific times that he believed were crucial for their recovery. This technique often resulted in death from blood loss. Praxagoras was also known for his use of exotic remedies imported from distant lands. He would give patients rare plants and minerals that were often highly toxic, claiming that their rarity made them more potent. These celebrity physicians were often protected by their wealthy and powerful patients, who believed that expensive treatments must be effective. This protection allowed them to continue their harmful practices without consequence. The reputation of these famous doctors also led to the spread of their dangerous techniques throughout the Greek world. Other physicians would copy their methods, multiplying the harm they caused. The influence of Greek medicine extended far beyond the borders of ancient Greece. Greek culture spread throughout the Mediterranean world, so did their medical practices, bringing their dangerous treatments to new populations. The conquest of Alexander the Great in the 4th century BCE spread Greek medicine throughout the known world. Greek physicians traveled with the armies, treating soldiers and establishing medical schools in conquered territories. This meant that the harmful practices of Greek medicine were introduced to Egypt, Persia, India, and other regions that had their own medical tradition. In many cases, these local traditions were displaced by Greek medicine, often with disastrous results. The Romans, in particular, adopted Greek medical practices wholesale. Roman physicians were often Greeks or trained in Greek methods, and they brought the full arsenal of dangerous treatments to the Roman world. The Roman military, for instance, adopted Greek battlefield medicine, which involved extensive use of cauterization and amputation. Roman soldiers who might have survived their wounds with proper care often died from the brutal medical treatments they received. Roman civilians also suffered from Greek-inspired medical practices. The wealthy Romans would hire Greek physicians to treat their ailments, often with fatal results. The poor, meanwhile, were treated by less skilled practitioners who used simplified versions of Greek treatments. The spread of Greek medicine also had a devastating effect on women's health throughout the ancient world. Greek beliefs about women's anatomy and physiology were adopted by other cultures, leading to harmful treatments for women everywhere. The Roman adoption of Greek obstetric practices, for instance, led to increased maternal mortality rates throughout the empire. Women who might have had successful pregnancies with traditional midwifery care often died from Greek-inspired medical interventions. Greek medicine also influenced the development of early Christian healing practices. Early Christian physicians often combined Greek medical theory with religious beliefs, creating treatments that were both medically dangerous and spiritually harmful. The monasteries of the early Christian church became centers of medical learning, but they primarily taught Greek medical practices. This meant that the harmful treatments of ancient Greece were preserved and passed down through the medieval period. The Islamic world also adopted many Greek medical practices, though they often improved upon them. Islamic physicians like Avicenna and Rhazes studied Greek medical texts and developed their own treatments, some of which were more effective than the original. However, the basic theoretical framework of Greek medicine, particularly the theory of the four humours, was adopted by Islamic physicians and continued to influence medical practice for centuries. The preservation of Greek medical texts by Islamic scholars also meant that these dangerous practices were eventually reintroduced to Europe during the Renaissance. European physicians rediscovered the works of Hippocrates and Galen and began practicing Greek medicine again. This revival of Greek medicine in medieval and Renaissance Europe led to a continuation of harmful practices that had been developed over 1,000 years earlier. Bloodletting, purging, and the use of toxic remedies continued to be standard medical practice well into the modern era. It's remarkable to think that the medical practices we've been discussing tonight continued to influence healing for nearly 2,000 years after the fall of ancient Greece. The slow death of these dangerous practices is a story of gradual enlightenment, but also of stubborn resistance to change. The Roman Empire largely adopted Greek medical practices, as we've discussed, but they also made some practical improvements. Roman military medicine, for instance, developed better surgical techniques and began to understand the importance of hygiene in preventing infection. However, the theoretical basis of Roman medicine remained rooted in Greek humoral theory. Roman physicians continued to believe that illness was caused by imbalances in the four humors, and they continued to use bloodletting, purging, and toxic remedies as primary treatments. The fall of the Roman Empire in the 5th century CE led to a period of medical stagnation in Europe. Many of the practical improvements that the Romans had made were lost, while the theoretical framework of Greek medicine was preserved in monasteries and religious institutions. During the medieval period, European medicine was dominated by the Catholic Church, which had preserved many Greek medical texts. Monks copied these texts by hand, ensuring that the dangerous practices of ancient Greece were passed down to future generations. Medieval physicians, like their Greek predecessors, believed that illness was caused by sin or divine punishment. They combined Greek medical theory with Christian theology, creating treatments that were both medically harmful and spiritually oppressive. The practice of bloodletting, for instance, was justified not only by humoral theory, but also by religious beliefs about purification and penance. Patients were told that their suffering was necessary for their spiritual salvation, which made them more willing to endure harmful treatment. The medieval period also saw the rise of alchemy, which combined Greek medical theory with magical beliefs. Alchemists developed new toxic remedies based on the theory of the four humors, often making existing treatments even more dangerous. The Renaissance brought a renewed interest in classical learning, including Greek medical texts. Scholars began to translate and study the works of Hippocrates and Galen, leading to a revival of ancient medical practice. However, the Renaissance also brought new skepticism and scientific thinking. Physicians like Paracelsus began to question the validity of ancient medical theory and to experiment with new treatments. The 16th and 17th centuries saw the beginning of modern scientific medicine. Physicians began to use observation and experimentation to test medical theories, rather than simply accepting ancient wisdom. The development of the scientific method gradually undermined the theoretical basis of Greek medicine. Physicians began to understand that bloodletting and purging were not effective treatments, and that many traditional remedies were actually harmful. However, the transition was slow and met with significant resistance. Many physicians were reluctant to abandon practices that had been used for centuries, and patients often demanded traditional treatments. The practice of bloodletting, for instance, continued well into the 19th. Even after physicians began to understand that it was harmful, many continued to use it because patients expected it. The last vestiges of Greek medicine didn't disappear until the development of modern germ theory in the late. Only when physicians began to understand the true causes of disease were they able to abandon the harmful practices of the past. While we can't know exactly how many people died from Greek medical treatments, we can estimate that the number was enormous. Consider that Greek medicine was practiced not just in Greece, but throughout the Mediterranean world for over 1,000 years. Every major city had physicians who practiced these dangerous treatments, and every family would have encountered them at some point. The practice of bloodletting alone probably killed millions of people over the century. Patients who were already weakened by illness would have their blood drained, often causing death from shock or blood loss. Even healthy people subjected to preventive bloodletting would sometimes die from the procedure. The use of toxic remedies was equally deadly. Greek physicians regularly administered substances like mercury, arsenic, and antimony, which are known to cause severe poisoning. Many patients who might have recovered from their original illness died from these toxic treatments. The surgical practices of the Greeks were also extraordinarily dangerous. The combination of crude instruments, unsanitary conditions, and lack of anesthesia meant that most surgical procedures were fatal. Even minor operations often resulted in death from infection or shock. The treatment of women was particularly deadly. The Greek belief that women's health problems were caused by a wandering uterus led to treatments that were often fatal. The practice of violent purging during pregnancy caused countless miscarriages and maternal death. Children were also at high risk from Greek medical practices. The application of adult treatments to small bodies often resulted in death from poisoning or blood loss. The high infant mortality rate in ancient Greece was due not just to disease, but to the harmful medical treatments that were routinely administered. The treatment of mental illness was perhaps the most deadly aspect of Greek medicine. Patients who were already vulnerable were subjected to brutal treatments that often resulted in death from neglect, malnutrition, or physical abuse. But perhaps the most tragic aspect of Greek medicine was that many of these deaths were preventable. In many cases, patients would have recovered naturally if they had simply been left alone. The aggressive interventions of Greek physicians often turned minor illnesses into fatal conditions. The psychological cost was also enormous. Patients who survived Greek medical treatments were often left traumatized by the experience. The pain and humiliation of these procedures created lasting psychological damage that affected people for the rest of their lives. Families were also devastated by the loss of loved ones to medical treatment. The death of a child from a preventable illness, or the loss of a mother during childbirth, created ripple effects that lasted for generations. The economic cost was significant as well. Greek medical treatments were expensive, and families often bankrupted themselves trying to save a loved one. The irony is that they were often paying for treatments that made their situation worse. The social cost was equally damaging. The high mortality rate from medical treatment created a culture of fear and superstition around illness. People became reluctant to seek medical help, which sometimes led to deaths that could have been prevented with proper care. Now, to be fair to the ancient Greeks, they weren't wrong about everything. Occasionally, their treatments actually worked, though often for reasons they didn't understand. These accidental successes helped to perpetuate harmful practices by giving physicians false confidence in their method. Take the Greek practice of using willow bark to treat pain and fever. They didn't understand why it worked, but it did provide some relief. What they didn't know was that willow bark contains salicin, a compound related to asp. This was one of the few Greek remedies that was actually effective. The Greeks also had some success with certain surgical procedures. They could set broken bones reasonably well, and their techniques for treating dislocations were sometimes effective. However, these successes were overshadowed by the many surgical procedures that were fatal. Greek physicians also occasionally succeeded in treating certain infections with honey and wine. Both of these substances have antibacterial properties, though the Greeks didn't understand the mechanism. They thought these treatments worked because they restored balance to the humors. The problem with these occasional successes is that they reinforced the Greeks' belief in their overall medical system. When a patient recovered after treatment, physicians would credit their intervention, even if the patient would have recovered anyway. This created a dangerous cycle where harmful practices were perpetuated because of occasional positive outcomes. Physicians would continue to use bloodletting, for instance, because they remembered the few cases where the patient survived, while forgetting the many cases where the patient died. The Greeks also had some success with certain dietary recommendations. They understood that good nutrition was important for health, and they often prescribed specific foods for certain conditions. Some of these recommendations were actually beneficial, though again they didn't understand why. However, even their dietary advice was often harmful. They would prescribe fasting for patients who were already malnourished, or they would recommend foods that were actually toxic. Their belief in the theory of hot and cold foods led to dietary restrictions that were often counterproductive. The Greeks also made some accurate observations about the course of certain diseases. They noticed that some illnesses followed predictable patterns, and they were able to make reasonably accurate prognoses in some cases. However, their understanding of disease causation was fundamentally flawed. They attributed illness to supernatural causes or to imbalances in the humors, rather than to the actual biological mechanisms involved. This meant that even when they made accurate observations, they often drew the wrong conclusions about treatment. They might correctly predict that a patient would recover from a fever, but then subject the patient to harmful treatments based on their flawed understanding of disease causation. While we've been focusing on the formal medical establishment of ancient Greece, it's important to remember that there were alternative healers who often provided safer and more effective care. These included midwives, herbalists, and folk healers who used traditional remedies passed down through generations. Midwives in particular often provided better care than trained physicians. They understood the natural process of childbirth and were less likely to intervene unnecessarily. Women who were attended by experienced midwives often had better outcomes than those who were treated by physicians. Traditional midwives used techniques like massage, positioning, and herbal remedies to ease labor and prevent complications. They understood the importance of cleanliness and would often insist on clean birthing environments. However, even these alternative healers were influenced by Greek medical theory. Many midwives adopted Greek beliefs about women's health and began using harmful treatments like bloodletting and purging during pregnancy. Herbalists were another group of alternative healers who sometimes provided effective treatment. They had extensive knowledge of local plants and their medicinal properties, and they often used gentler remedies than those prescribed by physicians. Some herbal remedies were actually effective, particularly those used to treat pain, digestive problems, and skin conditions. However, herbalists also used many toxic plants, and their treatments could be just as dangerous as those of trained physicians. Folk healers often combined herbal medicine with spiritual practices. They might use prayers, charms, and rituals along with medicinal plants. While the spiritual aspects of their practice were not medically effective, they sometimes provided psychological comfort to patients. The problem with all of these alternative healers was that they lacked scientific understanding of disease and treatment. They relied on tradition and superstition rather than observation and experimentation. This meant that even when their treatments were effective, they didn't understand why they worked. They couldn't systematically improve their methods or distinguish between effective and ineffective treatment. The influence of Greek medical theory also corrupted many traditional healing practices. Folk healers began to adopt Greek concepts like the four humors and started using more aggressive treatments that were often harmful. Throughout our exploration of ancient Greek medicine, we've focused primarily on the physicians and their practices. But what was it like to be a patient in ancient Greece? What did people think about these treatments? And how did they cope with the often fatal consequences? The experience of being a patient in ancient Greece was terrifying. Illness was already frightening enough, but the prospect of medical treatment added another layer of fear and suffering. Patients knew that medical intervention was often more dangerous than the disease itself. However, people in ancient Greece had few alternatives. When faced with serious illness, they felt compelled to seek medical help, even knowing the risks. The fear of death from disease often outweighed the fear of death from treatment. Patients also had to deal with the enormous expense of medical care. Greek physicians charged high fees for their services, and the cost of exotic remedies could bankrupt a family. Many people went into debt to pay for medical treatment, only to lose their loved ones anyway. The social pressure to seek medical care was also significant. Families who didn't hire a physician for a sick relative were often criticized by their community. There was a social expectation that people would do everything possible to save their loved ones, even if that meant subjecting them to harmful treatments. Patients also had to cope with the pain and indignity of Greek medical procedures. Most treatments were extremely painful, and patients had no effective pain relief. They had to endure procedures like bloodletting, purging, and surgery while fully conscious. The psychological impact of these treatments was enormous. Patients who survived Greek medical care were often left traumatized by the experience. The memory of extreme pain and suffering stayed with them for the rest of their lives. Families also suffered greatly from the experience of watching their loved ones undergo these brutal treatments. Parents had to watch their children suffer through painful procedures, but often failed to help. Spouses had to watch their partners deteriorate under medical care. The high failure rate of Greek medicine created a culture of fatalism and despair. People came to expect that serious illness would result in death, regardless of medical intervention. This fatalistic attitude sometimes prevented people from seeking help when it might have been beneficial. However, some patients did find ways to cope with the brutality of Greek medicine. They developed support networks with other patients and families who had gone through similar experiences. They also turned to religion and philosophy for comfort and meaning. The Stoic philosophy, which was popular in ancient Greece, taught people to accept suffering as part of life. This philosophical approach helped some patients endure the pain of medical treatment with greater equanimity. While most Greek medical treatments have been abandoned, the influence of Greek medicine can still be felt in modern healthcare. The Greek emphasis on observation and rational inquiry laid the foundation for modern scientific medicine. The idea that diseases have natural causes rather than supernatural ones was a crucial development that eventually led to effective medical treatments. The Greek concept of medical ethics, embodied in the Hippocratic Oath, continues to influence medical practice today. The principle of first, do no harm remains central to medical education and practice, even though the Greeks themselves often violated this principle. The Greek tradition of medical writing and documentation also had a lasting impact. Greek physicians were among the first to systematically record their observations and treatments, creating a body of medical literature that influenced healing practices for centuries. However, the negative legacy of Greek medicine is equally important to understand. The persistence of harmful practices like bloodletting and purging shows how difficult it can be to abandon established medical traditions, even when they are proven to be ineffective. The Greek example also illustrates the dangers of medical dogma. When physicians become too attached to particular theories or treatments, they may continue to use them long after evidence shows they are harmful. The story of Greek medicine also highlights the importance of understanding the mechanisms behind medical treatment. The Greeks occasionally stumbled upon effective treatments, but because they didn't understand why they worked, they couldn't systematically improve their methods. Modern medicine has learned many lessons from the failures of ancient Greek medicine. The emphasis on evidence-based practice, the importance of controlled clinical trials, and the need for rigorous testing of new treatments all reflect an understanding of the dangers of untested medical intervention. The development of anesthesia, antiseptics, and antibiotics has eliminated many of the horrors of ancient medical practice. Modern surgical techniques, pain management, and infection control have made medical treatment far safer than it was in ancient. However, the story of Greek medicine also serves as a cautionary tale for modern healthcare. It reminds us that medical knowledge is always evolving, and that treatments that seem effective today may be proven harmful tomorrow. The history of Greek medicine also highlights the importance of patient advocacy and informed consent. Patients in ancient Greece had little say in their treatment, and were often subjected to harmful procedures without their knowledge or consent. Modern medical ethics emphasizes the importance of patient autonomy and the right to refuse treatment. This represents a significant departure from the paternalistic approach of ancient Greek medicine. The story of ancient Greek medicine reveals fascinating aspects of human nature that remain relevant today. The willingness of patients to endure painful and dangerous treatments, the persistence of physicians in using ineffective methods, and the slow pace of medical progress all reflect deeper truths about how humans respond to illness and uncertainty. One of the most striking aspects of Greek medicine is the way that cultural beliefs and social pressures influenced medical practice. Physicians used treatments that were clearly harmful, but they continued to use them because they were socially expected and culturally acceptable. This phenomenon extends far beyond the realm of medicine, reflecting a fundamental aspect of human psychology. Our tendency to conform to social expectations, even when they conflict with our own observations or better judgment. The social dynamics of ancient Greek medical practice were complex and multifaceted. Physicians operated within a rigid hierarchical system where reputation and social standing were paramount. A physician who deviated too far from accepted practices risked not only professional ostracism, but also legal consequence. In ancient Athens, physicians could be prosecuted for malpractice if their treatments failed, but this prosecution was based on whether they followed established procedures, rather than whether those procedures were actually effective. This shows how powerful social conformity can be, even in matters of life and death. Physicians who might have privately doubted the effectiveness of bloodletting or purging continued to use these treatments because they were part of established medical practice. The psychological pressure to conform was reinforced by the structure of medical education, which emphasized memorization of classical texts rather than independent observation or experimentation. The apprenticeship system that dominated Greek medical education created a powerful mechanism for perpetuating established practices. Young physicians learned by observing and imitating their masters, creating a feedback loop that reinforced traditional methods. Those who showed promise were often those who could most faithfully reproduce the techniques and theories of their predecessors. Innovation was not only discouraged, but was often seen as a sign of arrogance or incompetence. The story also illustrates the human tendency to prefer action over inaction, even when inaction might be more beneficial. Greek physicians felt compelled to do something for their patients, even when the best course of action might have been to do nothing. This psychological compulsion to act is deeply rooted in human nature and reflects our fundamental discomfort with helplessness and uncertainty. The ancient Greek concept of medical heroism contributed to this therapeutic imperative. Physicians who employed dramatic and aggressive treatments were often seen as more skilled and dedicated than those who recommended rest and observation. The cultural narrative surrounding healing emphasized the physician as an active agent battling disease, rather than as a guide supporting the body's natural healing process. This therapeutic imperative, the belief that medical intervention is always better than no intervention, continues to influence medical practice today. Modern physicians sometimes struggle with the same impulse to act, even when watchful waiting might be more appropriate. The pressure to do something is intensified by patient expectations, legal concerns, and the economic incentives of medical practice. Contemporary examples of this therapeutic imperative are numerous and troubling. The overuse of antibiotics for viral infections, the excessive ordering of medical tests, and the tendency to treat numerical abnormalities rather than clinical symptoms all reflect this ancient bias toward action. Studies have shown that physicians who are more comfortable with uncertainty and who can tolerate periods of observation often achieve better patient outcomes than those who feel compelled to intervene aggressively. The persistence of harmful medical practices also reflects the human difficulty in accepting uncertainty. Greek physicians created elaborate theories about disease causation and treatment, even when they had no real understanding of the underlying mechanism. The four humus theory, with its complex system of hot, cold, wet, and dry qualities, provided a comprehensive framework for understanding illness that was intellectually satisfying even though it was fundamentally incorrect. These theories provided a sense of certainty and control in the face of illness and death. They allowed physicians to feel that they were doing something meaningful even when their treatments were actually harmful. The psychological comfort of having a complete explanatory system cannot be underestimated. It provided both physicians and patients with a sense of understanding and control in situations that were inherently uncertain and frightening. The human need for explanatory narratives is so powerful that we often prefer incorrect explanations to no explanation at all. Greek physicians constructed elaborate causal chains to explain disease, even when these explanations were based on minimal evidence. For example, they might attribute a fever to an excess of yellow bile caused by eating too much warm food in summer, then prescribe a treatment involving cold foods and bloodletting to restore balance. This tendency to create overconfident explanatory systems persists in modern medicine. The history of medical practice is littered with theories that seemed compelling at the time but were later proven false. The peptic ulcer was long attributed to stress and spicy food, until the discovery of Helicobacter pylori bacteria. Hormone replacement therapy was widely prescribed for decades based on theoretical benefits that were later shown to be outweighed by serious risks. The story of Greek medicine also shows how difficult it can be to abandon established practices, even when evidence shows they are ineffective. The investment of time, training, and reputation in particular treatments makes it psychologically difficult to admit that they don't work. This phenomenon, known as the sunk cost fallacy, affects individuals and institutions alike. Physicians who had spent years learning to perform complex procedures or who had built their reputations on particular treatments had strong psychological and economic incentives to continue using them. The admission that a treatment was ineffective implied not only that past efforts had been wasted, but also that patients had been harmed. This psychological burden was often too great to bear, leading to rationalization and denial rather than acknowledgement of error. The institutional structures of ancient Greek medicine reinforced these individual psychological biases. Medical schools had invested heavily in teaching particular approaches, and changing curricula required admitting that previous instruction had been inadequate. Professional associations had developed around specific techniques, and abandoning these techniques threatened the social and economic foundations of the profession. This psychological resistance to change continues to influence medical practice today. New treatments that challenge established practices often face resistance from physicians who have built their careers on older methods. The phenomenon is particularly pronounced in surgical specialties, where practitioners have invested years in developing specific technical skills that may become obsolete as new approaches are developed. The adoption of minimally invasive surgical techniques provides a modern example of this resistance. Despite clear evidence of benefits for patients, including reduced pain, shorter recovery times, and lower complication rates, many surgeons were slow to adopt laparoscopic and robotic technique. The investment in traditional open surgical skills, combined with the learning curve required for new approaches, created significant barriers to change. The human cost of Greek medicine also reflects the broader tragedy of well-intentioned actions that cause harm. Greek physicians generally believed they were helping their patients, but their lack of understanding led them to cause enormous suffering. This raises profound questions about the relationship between good intentions and good outcomes, and about the responsibility of professionals to acknowledge the limitations of their knowledge. The ethical implications of well-intentioned harm are complex and enduring. Greek physicians operated within the moral framework of their time, believing that their treatments were beneficial based on the best available knowledge. However, their confidence in unproven methods led to widespread suffering that could have been avoided through greater humility and more careful observation. The phenomenon of iatrogenic harm caused by medical treatment, was endemic in ancient Greek medicine. Bloodletting weakened patients and made them more susceptible to infection. Purging caused dehydration and electrolyte imbalances. Surgical procedures performed without antiseptic precautions led to widespread infection and death. Yet these treatments continued to be used because they were consistent with prevailing theories, and because alternatives were not available. The psychological mechanisms that allowed Greek physicians to continue harmful practices despite evidence of their ineffectiveness provide insight into human nature more broad. The tendency to interpret ambiguous evidence in ways that support existing beliefs, the reluctance to acknowledge error, and the desire to maintain professional status all contributed to the persistence of harmful practices. Modern medicine has not entirely escaped these psychological traps. The history of medical practice includes numerous examples of treatments that were widely used despite limited evidence of effectiveness. The extensive use of bed rest for heart attack patients, the routine use of hormone replacement therapy for postmenopausal women, and the widespread prescription of arthroscopic knee surgery for osteoarthritis all reflect the persistence of these ancient patterns. This serves as a reminder of the importance of humility in medical practice. The recognition that our current understanding is limited and that future generations may view our practices as primitive should encourage caution and continuous learning. The history of medicine is a history of confident assertions later proven false, of treatments that seemed obviously beneficial later shown to be harmful, and of theories that appeared comprehensive, later revealed to be inadequate. The cultivation of intellectual humility requires both individual and institutional changes. Individual physicians must be trained to recognize the limits of their knowledge and to tolerate uncertainty. They must be encouraged to question established practices and to seek evidence for their effectiveness. They must be rewarded for acknowledging error and for changing practices based on new evidence. Institutional changes are equally important. Medical schools must teach the history of medical error alongside current best practices. Professional organizations must create mechanisms for rapidly disseminating new evidence and for updating practice guidelines. Healthcare systems must provide incentives for evidence-based practice and must protect physicians who challenge established but ineffective treatments. The story of Greek medicine also highlights the importance of patient autonomy and informed consent. Greek patients had little choice but to accept the treatments offered by their physicians, often without understanding their risks or benefits. The paternalistic model of medicine that dominated ancient practice persisted well into the modern era, and its legacy continues to influence medical practice today. The development of the doctrine of informed consent represents a significant advance in medical ethics, but it raises complex questions about the limits of patient autonomy. When patients lack the technical knowledge to evaluate treatment options, how can they make truly informed decisions? When emotions and fear cloud judgment, how can consent be truly voluntary? These questions, first raised in ancient Greece, remain relevant today. The economic dimensions of Greek medicine also provide insight into human nature. The practice of medicine was largely a commercial enterprise, with physicians competing for patients and charging fees for their services. This created incentives for dramatic and expensive treatments, even when simpler and less costly approaches might have been more effective. The commercialization of medicine created conflicts of interest that influenced treatment decisions. Physicians who earned more from complex procedures had financial incentives to recommend them, even when they were not medically necessary. This problem was compounded by the lack of objective measures of treatment effectiveness, which made it difficult for patients to distinguish between necessary and unnecessary interventions. These economic pressures continue to influence modern medical practice. The fee-for-service model that dominates healthcare in many countries creates incentives for over-treatment and over-diagnosis. Physicians who are paid more for doing more procedures have financial incentives to recommend them, even when they may not be in the patient's best interest. The story of Greek medicine ultimately reveals the complexity of human nature and the challenges of making progress in the face of uncertainty. The same psychological mechanisms that led to harmful practices also enabled the development of medical knowledge over time. The confidence and authority that physicians projected, while sometimes misplaced, also provided comfort and hope to patients facing illness and death. Understanding these patterns can help us navigate the challenges of modern medicine more effectively. By recognizing our psychological biases and institutional limitations, we can work to create systems that promote evidence-based practice while maintaining the human elements of healing that patients need and deserve. The transition from ancient Greek medicine to modern scientific medicine was not a sudden revolution, but a gradual process that took centuries. Understanding this transition helps us appreciate both the progress that has been made and the ongoing challenges in medical practice. The path from superstition to science was neither straight nor smooth, marked by false starts, fierce resistance, and remarkable breakthroughs that fundamentally changed our understanding of human health and disease. The medieval period, often characterized as the Dark Ages, saw both regression and subtle progress in medical knowledge. The fall of the Roman Empire led to the loss of much classical medical knowledge in Western Europe, but this knowledge was preserved and expanded upon in the Islamic world. Physicians like Al-Razi and Avicenna made significant contributions to medical understanding, particularly in the areas of diagnosis and pharmaceutical preparation. Islamic medicine during this period was characterized by a more empirical approach than had been common in ancient Greek practice. Islamic physicians were more willing to question classical authorities and to base their conclusions on direct observation. They developed more sophisticated methods of clinical observation and were among the first to use systematic approaches to medical education and hospital management. The first major breakthrough in Western Europe came during the Renaissance, when physicians began to question the authority of ancient texts and started making their own observations. Andreas Vesalius, for example, challenged the anatomical teachings of Galen by performing his own dissections and discovering numerous errors in ancient texts. This represented a fundamental shift in the epistemological foundations of medicine, moving from a system based on textual authority to one based on direct observation. Vesalius's work, De Humani Corporis Fabrica, on the fabric of the human body, published in 1543, was revolutionary not just for its anatomical accuracy but for its methodology. Vesalius insisted that medical students should perform their own dissections rather than simply watching demonstrations. He argued that direct observation was superior to textual study, a position that was considered radical at the time. The resistance to Vesalius's work illustrates the psychological and institutional barriers to scientific progress. Many physicians refused to accept his findings, even when presented with clear anatomical evidence. They argued that if Vesalius's observations contradicted Galen, then human anatomy must have changed since ancient times. This rationalization allowed them to maintain their reverence for classical authority while dismissing inconvenient evidence. This shift from authority-based medicine to observation-based medicine was crucial. Instead of simply accepting what ancient physicians had written, doctors began to look for themselves and trust their own observation. This transformation was not merely technical but philosophical, representing a fundamental change in how knowledge was created and validated. The development of the printing press in the 15th century accelerated this transformation by making medical texts more widely available and enabling the rapid dissemination of new discoveries. The standardization of medical texts also made it easier to identify contradictions and errors in classical sources. For the first time, physicians across Europe could compare their observations and build upon each other's work. The Renaissance also saw the development of new surgical techniques and instruments. Ambroise Paré, a French surgeon, developed new methods for treating gunshot wounds and pioneered the use of prosthetics for amputees. His works demonstrated the value of practical experience over theoretical knowledge and helped establish surgery as a legitimate medical specialty. The development of the scientific method in the 17th century provided a framework for systematic medical research. Physicians began to use controlled experiments to test the effectiveness of different treatments, rather than simply relying on tradition or theory. This methodological revolution was championed by figures like Francis Bacon, who argued for the importance of empirical observation and systematic experimentation. The application of the scientific method to medicine was slow and uneven. Many physicians continued to rely on traditional approaches, viewing the new experimental methods as either impractical or inappropriate for medical practice. The idea that treatments should be tested before being widely adopted was foreign to most practitioners, who were accustomed to relying on theoretical reasoning and clinical experience. One of the earliest examples of controlled medical experimentation was conducted by James Lind, a Scottish physician who studied the treatment of scurvy aboard naval vessels. In 1747, Lind divided 12 sailors with scurvy into 6 groups and gave each group different treatment. The group that received citrus fruits recovered most quickly, providing strong evidence for the value of vitamin C in preventing scurvy. However, the transition was slow and uneven. Many physicians continued to use traditional treatments long after better alternatives were available. The practice of bloodletting, for example, continued well into the 19th century, even after evidence began to accumulate that it was harmful. This persistence of harmful practices reflects the power of tradition and the difficulty of changing established professional habits. The continued use of bloodletting provides a particularly instructive example of the challenges of medical progress. Despite growing evidence of its ineffectiveness and potential harm, bloodletting remained a standard treatment for many conditions well into the 80s. Physicians rationalized its continued use by arguing that it worked in some cases, or that it was better than doing nothing. The psychological investment in bloodletting was enormous. Physicians had spent years learning to perform the procedure, and had built their reputations on their skill in its application. Abandoning bloodletting would have required admitting that much of their training had been based on false premises, and that they had potentially harmed patients through their well-intentioned interventions. The institutional support for bloodletting was also significant. Medical schools taught the procedure as a fundamental skill, and textbooks devoted extensive coverage to its various applications. Professional organizations endorsed its use, and medical journals published articles defending its efficacy. This institutional momentum made it difficult for individual physicians to abandon the practice, even when their personal experience suggested that it was ineffective. The eventual decline of bloodletting illustrates the importance of statistical thinking in medicine. As physicians began to keep more careful records and to compare outcomes across different treatments, the evidence against bloodletting became overwhelming. The development of statistical methods in the 19th century provided tools for analyzing large datasets and identifying patterns that might not be apparent in individual cases. The development of germ theory in the late 19th century marked another major breakthrough, when physicians began to understand that many diseases were caused by microorganisms. They could finally abandon the ancient theory of the four humours. This conceptual revolution was as important as any technical advancement, providing a new framework for understanding disease that was both more accurate and more useful than its predecessor. The development of germ theory was not the work of a single individual, but rather the result of contributions from many scientists and physicians. Ignaz Semmelweis demonstrated the importance of hand hygiene in preventing childbed fever, though his findings were initially rejected by the medical establishment. Louis Pasteur showed that microorganisms caused fermentation and disease, while Robert Koch developed methods for identifying specific disease-causing bacteria. The resistance to germ theory was fierce and prolonged. Many physicians found it difficult to accept that invisible organisms could cause disease, particularly when this theory challenged established beliefs about disease causation. The idea that diseases were caused by miasmas, bad air, or imbalances in body fluids was deeply entrenched in medical thinking and was not easily displaced. This understanding led to the development of antiseptic surgery, which dramatically reduced the mortality rate from surgical procedure. Joseph Lister's adoption of carbolic acid for surgical antisepsis transformed surgery from a last resort to a viable treatment option for many conditions. The reduction in surgical mortality was so dramatic that it provided compelling evidence for the validity of germ theory. The acceptance of antiseptic surgery illustrates the importance of practical results in driving medical progress. While theoretical arguments for germ theory were often dismissed or ignored, the dramatic reduction in surgical mortality was impossible to deny. This practical success helped overcome theoretical objections and accelerated the adoption of antiseptic practices. It also led to the development of vaccines and antibiotics, which saved millions of lives. The understanding that diseases were caused by specific microorganisms opened up new possibilities for prevention and treatment. Vaccines could be developed to stimulate immunity against specific pathogens, while antibiotics could be used to kill or inhibit the growth of disease-causing bacteria. The development of vaccines represents one of the greatest achievements in medical history. Edward Jenner's smallpox vaccine, developed in the late 18th century, was the first successful vaccine and demonstrated the principle of immunization. The subsequent development of vaccines against diseases like polio, measles, and influenza has prevented countless deaths and has virtually eliminated some diseases that were once major killers. The development of antibiotics in the 20th century was equally revolutionary. Alexander Fleming's discovery of penicillin in 1928 opened the door to the treatment of bacterial infections that had previously been fatal. The mass production of antibiotics during World War II saved countless lives and established the pharmaceutical industry as a major force in health. The 20th century saw the rise of evidence-based medicine, which emphasizes the importance of rigorous clinical trials in evaluating medical treatments. This approach has helped to eliminate many ineffective treatments and has accelerated the development of new therapies. The randomized controlled trial developed in the mid-20th century, became the gold standard for evaluating medical interventions. The development of evidence-based medicine represented a maturation of the scientific approach to health. Rather than relying on clinical experience or theoretical reasoning, physicians began to demand rigorous evidence of effectiveness before adopting new treatments. This approach has led to more effective treatments and has helped to reduce the use of ineffective or harmful intervention. The Cochrane collaboration, established in the 1990s, represents the institutionalization of evidence-based medicine. This international network of researchers systematically reviews medical evidence and provides guidance to healthcare professionals about the effectiveness of different treatments. The Cochrane reviews have become an essential resource for physicians seeking to base their practice on the best available evidence. However, the legacy of ancient Greek medicine continues to influence modern practice in subtle ways. The emphasis on intervention over observation, the tendency to treat symptoms rather than underlying causes, and the difficulty in accepting uncertainty all reflect patterns that were established in ancient times. These psychological and cultural patterns are deeply ingrained and are not easily changed by scientific advances alone. The modern tendency toward overdiagnosis and overtreatment reflects the ancient therapeutic imperative. Despite advances in our understanding of disease, many physicians still feel compelled to do something for their patients, even when watchful waiting might be more appropriate. This bias toward action is reinforced by patient expectations, legal concerns, and economic incentives. The medicalization of normal human experiences, such as grief, shyness, and aging, reflects the ancient tendency to pathologize conditions that might be better understood as normal variations in human experience. The expansion of diagnostic categories and the lowering of thresholds for treatment have led to situations where healthy individuals are labeled as diseased and subjected to potentially harmful interventions. Modern medicine has also had to grapple with some of the same ethical issues that faced ancient physicians. The balance between patient autonomy and medical paternalism, the allocation of scarce medical resources, and the treatment of terminal illness, all echo debates that began in ancient Greece. These ethical dilemmas have no easy solutions and continue to challenge healthcare professionals today. The principle of informed consent, which requires physicians to explain the risks and benefits of treatments to patients, represents an evolution from the paternalistic model of ancient medicine. However, the implementation of informed consent raises complex questions about the limits of patient autonomy and the responsibilities of healthcare professionals. The allocation of medical resources remains a contentious issue, particularly as healthcare costs continue to rise and new technologies expand treatment options. The ancient Greek concept of medical justice, which emphasized the physician's duty to treat all patients regardless of their ability to pay, conflicts with the economic realities of modern healthcare systems. The treatment of terminal illness continues to raise difficult questions about the goals of medicine and the limits of intervention. The ancient Greek emphasis on prolonging life at all costs conflicts with modern concepts of palliative care and quality of life. The development of hospice care and the acceptance of death as a natural process represent important advances in medical ethics. The story of medical progress also highlights the importance of institutional support for scientific research. The development of modern medicine required not just individual genius, but also universities, hospitals, and research institutions that could support systematic investigation. The establishment of medical schools, teaching hospitals, and research laboratories created the infrastructure necessary for scientific progress. The modern medical research enterprise represents a remarkable achievement in human organization and cooperation. The National Institutes of Health, established in the United States in the 1930s, became a model for government support of medical research. Similar institutions in other countries have contributed to a global network of medical research that has accelerated the pace of discovery. The pharmaceutical industry has also played a crucial role in medical progress, developing new drugs and technologies that have transformed healthcare. The relationship between academic researchers and pharmaceutical companies has been both productive and problematic, raising questions about conflicts of interest and the commercialization of medical knowledge. The development of medical specialization has been both a blessing and, on one hand, specialization has led to remarkable advances in the treatment of specific diseases and conditions. Specialists have developed expertise that would be impossible for generalists to maintain, and this has led to improved outcomes for patients with complex conditions. On the other hand, specialization has led to fragmentation of care and a loss of the holistic perspective that characterized ancient medicine. Patients may receive excellent treatment for specific conditions while their overall health and well-being are neglected. The challenge of coordinating care across multiple specialists has become a major issue in modern healthcare. The information revolution has transformed medical practice in ways that are still being understood. The availability of vast amounts of medical information online has empowered patients to become more informed about their conditions and treatment options. However, it has also created new challenges in distinguishing reliable information from misinformation. The development of electronic health records has improved the coordination of care and has made it easier to track patient outcomes over time. However, it has also created new administrative burdens for physicians and has sometimes interfered with the doctor-patient relation. The future of medicine promises continued advances in our understanding of disease and the development of new treatments. The Human Genome Project has opened up new possibilities for personalized medicine. While advances in artificial intelligence may revolutionize diagnosis and treatment, however, these advances also raise new ethical questions about privacy, equity, and the nature of human enhancement. The story of medical progress from ancient Greece to the present day illustrates both the potential and the limitations of human knowledge. The same psychological mechanisms that led to harmful practices in ancient times continue to influence medical practice today. However, the development of scientific methods and institutional safeguards has made it possible to identify and correct errors more quickly than in the past. The ongoing challenge for medicine is to maintain the human elements of healing while continuing to advance the scientific understanding of disease. The art and science of medicine must be balanced, with neither dominating the other. This balance requires constant vigilance and a commitment to both evidence-based practice and compassionate care. The lessons of medical history remind us that progress is neither inevitable nor irreversible. The advances that have been made can be lost if we become complacent, or if we fail to maintain the institutions and practices that support scientific inquiry. The story of medicine is ultimately a story of human perseverance and ingenuity, but it is also a reminder of our full ability and the importance of humility in the face of uncertainty. As we reflect on the dangerous world of ancient Greek medicine, what lessons can we draw for modern healthcare? While we've made enormous progress since the time of Hippocrates, the history of Greek medicine offers important insights that remain relevant today. First, the story of Greek medicine reminds us of the importance of evidence-based practice. The Greeks created elaborate theories about disease and treatment, but they rarely tested these theories systematically. Modern medicine's emphasis on clinical trials and evidence-based guidelines reflects a hard-won understanding of the dangers of untested treatments. However, even today, medical practice sometimes lags behind scientific evidence. Treatments that have been shown to be ineffective may continue to be used because of tradition, financial incentives, or physician preference. The history of Greek medicine reminds us to be vigilant about this tendency. Second, the Greek example illustrates the importance of understanding the mechanisms behind medical treatments. The Greeks occasionally stumbled upon effective treatments, but because they didn't understand why they worked, they couldn't systematically improve their methods or distinguish between effective and ineffective treatment. Modern medicine's emphasis on understanding the biological mechanisms of disease and treatment has been crucial to medical progress. This understanding allows us to develop more effective treatments and to predict potential side effects. Third, the story of Greek medicine highlights the importance of patient safety and the principle of first, do no harm. The Greeks' willingness to use dangerous treatments, even when they weren't sure they would work, led to enormous suffering and death. Modern medicine's emphasis on patient safety, informed consent, and risk-benefit analysis reflects an understanding of the dangers of medical intervention. The development of safety protocols, adverse event reporting systems, and quality improvement programs all represent attempts to learn from the mistakes of the past. Fourth, the Greek example shows how cultural beliefs and social pressures can influence medical practice in ways that may not be beneficial to patients. Greek physicians used treatments that were clearly harmful, but they continued to use them because they were socially expected and culturally acceptable. Modern medicine continues to struggle with similar issues. Cultural beliefs about gender, race, and class can influence medical treatment in ways that may not be beneficial to patients. The history of Greek medicine reminds us to be aware of these influences and to strive for objective, evidence-based. Fifth, the story of Greek medicine illustrates the importance of humility in medical practice. Greek physicians were often overconfident in their treatments, leading them to use dangerous interventions when more conservative approaches might have been better. Modern medicine's emphasis on shared decision-making, patient autonomy, and the acknowledgement of uncertainty reflects an understanding of the dangers of medical hubris. The recognition that our current understanding is limited and that future generations may view our practices as primitive should encourage caution and continuous learning. As we near the end of our journey through the world of ancient Greek medicine, it's important to remember that behind all the theories and treatments we've discussed were real people who suffered and died. The abstract concepts of humoral theory and bloodletting become much more meaningful when we consider the human cost. Imagine a young mother in ancient Athens suffering from what we would now recognize as postpartum depression. Instead of receiving support and understanding, she would be told that her uterus was wandering around her body, causing her distress. She would be subjected to violent treatments designed to force her uterus back into place. The pain and humiliation of these treatments would compound her emotional suffering. If she survived the physical trauma, she would still be left to deal with the psychological aftermath of the experience. Many women in her situation did not survive. Consider a child in ancient Greece who developed what we would now recognize as epilepsy. Instead of receiving appropriate medical care, the child would be told that they had too much phlegm in their brain. The treatment would involve drilling a hole in their skull while they were fully conscious. The terror and agony of this procedure would be beyond imagination. Most children who underwent trepanation died from the procedure itself. Those who survived often suffered severe brain damage that made their condition worse. Think about an elderly man in ancient Greece who developed what we would now recognize as pneumonia. Instead of receiving supportive care that might help him recover, he would be subjected to repeated bloodletting that would weaken his already compromised immune system. The physician would drain pints of blood from his body, leaving him pale, weak, and unable to fight off the infection. He would die not from the pneumonia, but from the treatment that was supposed to cure him. These are not abstract historical examples. They represent millions of real people who suffered and died because of the limitations of ancient medicine. Each death represented a family tragedy, a community loss, and a waste of human potential. The psychological impact of these treatments extended far beyond the individual patient. Families who watched their loved ones suffer through brutal medical procedures were left traumatized by the experience. The memory of watching a child die from trepanation or a spouse die from bloodletting would haunt them for the rest of their lives. The social impact was equally devastating. The high mortality rate from medical treatment created a culture of fear and superstition around illness. People became reluctant to seek medical help, which sometimes led to deaths that could have been prevented with proper care. The economic impact was also significant. Families would spend their life savings on medical treatments that were more likely to kill than cure. The irony is that they were often paying for the privilege of watching their loved ones suffer and die. But perhaps the most tragic aspect of Greek medicine was the lost potential. How many brilliant minds were lost to bloodletting? How many artists, philosophers, and inventors died from medical treatments that were supposed to heal them? How many children, never had the chance to grow up because their parents trusted in the wisdom of ancient physicians. The story of Greek medicine serves as a powerful reminder of the importance of medical progress. Every advancement in medical knowledge, every new treatment that actually works, every safety protocol that prevents harm, all of these represent victories over the kind of suffering that was routine in ancient times. As we conclude our exploration of ancient Greek medicine, we find ourselves with a complex legacy. The Greeks gave us the foundations of rational medicine, the idea that diseases have natural causes and can be treated through observation and reason. Yet they also gave us centuries of harmful practices that killed millions of people. The story of Greek medicine is ultimately a story about the human struggle to understand and control illness and death. The Greeks faced the same diseases we face today: infections, injuries, mental illness, and chronic conditions. They desperately wanted to help their patients, just as modern physicians do, but their lack of scientific understanding led them down dangerous paths. They created elaborate theories that seemed logical but were fundamentally flawed. They developed treatments that seemed reasonable but were actually harmful. They built a medical system that was more dangerous than the diseases it was meant to cure. The persistence of these harmful practices for over 2,000 years shows how difficult it is to abandon established medical tradition. Even when evidence began to accumulate that bloodletting and purging were ineffective, physicians continued to use them because they were part of established practice. This resistance to change is not unique to ancient times. Modern medicine continues to struggle with the same issue. New treatments that challenge established practices often face resistance from physicians who have built their careers on older methods. The story of Greek medicine also illustrates the importance of understanding the mechanisms behind medical treatment. The Greeks occasionally stumbled upon effective treatments, but because they didn't understand why they worked, they couldn't systematically improve their methods. Modern medicine's emphasis on understanding the biological mechanisms of disease and treatment has been crucial to medical progress. This understanding allows us to develop more effective treatments and to predict potential side effects. But perhaps the most important lesson from the story of Greek medicine is the importance of humility in medical practice. The Greeks were often overconfident in their treatments, leading them to use dangerous interventions when more conservative approaches might have been better. The recognition that our current understanding is limited and that future generations may view our practices as primitive should encourage caution and continuous learning. We must always be willing to question established practices and to change course when evidence shows that we are wrong. The story of Greek medicine is also a testament to human resilience. Despite the dangers of ancient medical practice, people continued to seek help when they were sick. They endured painful and often fatal treatments because they hoped for healing. This hope for healing is what drives medical progress. It's what motivates physicians to continue learning and improving their practice. It's what inspires researchers to develop new treatments and technology. The Greeks may have been wrong about many things, but they were right about one crucial point. Illness and suffering are not inevitable. They can be understood, treated, and eventually conquered. This belief in the possibility of healing is perhaps their greatest gift to modern medicine. As we drift off to sleep tonight, we can be grateful that we live in an age when medical treatment is more likely to help than harm. We can be thankful for the centuries of medical progress that have eliminated many of the horrors of ancient practice. But we should also remember the lessons of the past. The story of Greek medicine reminds us that medical knowledge is always evolving, and that treatments that seem effective today may be proven harmful tomorrow. The humility to acknowledge our limitations, the courage to change course when we are wrong, and the commitment to evidence-based practice. These are the qualities that will help us avoid the mistakes of the past and continue to improve the health and well-being of future generations. In the end, the story of ancient Greek medicine is not just a historical curiosity. It's a reminder of how far we've come and how far we still have to go. It's a testament to the human capacity for both error and learning, for both harm and healing. And so, as we close this chapter on one of medicine's darker periods, We can take comfort in the knowledge that each generation of physicians has learned from the mistakes of the past and has worked to build a better future for their patients. The dangerous world of ancient Greek medicine is behind us, but its lessons remain. May we continue to learn from them, and may we never forget the human cost of medical arrogance and the importance of genuine healing. Sleep well, knowing that the physicians of today are armed with knowledge and tools that the Greeks could never have imagined, and dream of a future where the medical mistakes of our own time will seem as primitive and shocking as the bloodletting and trepanation of ancient